Brain aneurysm and neuronal linkage. Brain aneurysm is a weak spot in the wall of the blood vessel in the brain. Over time, that weak area can bulge outward like a balloon. Many aneurysms remain stable throughout a person's life, but if one ruptures, it causes bleeding around the brain, a medical emergency, and requires immediate treatment. Hi, my name is Dr. Wes, and today we're going to discuss brain aneurysm. Brain aneurysm is a silent vascular weakness that can rupture and collapse neuronal communication. For definition, a brain aneurysm is abnormal balloon-like outpouching where weakened intracranial arterial wall. Blood into the subarachnoid space causes sudden severe headache, meningeal irritation, vasospasm, raised intracranial pressure, ischemia, seizures, coma, and death. Common location: anterior communicating artery, posterior communicating artery, middle cerebral artery, internal carotid artery, basilar artery. These are the main regions. Risk factors: hypertension, smoking, family history, connective tissue disease, polycystic kidney disease, and the use of the stimulants like cocaine and other stimulants. Mechanism: wall weakness, hemodynamic stress, outpouching, compression, and that causes the rupture of the artery. Most aneurysms form at arterial bifurcation where flow stress is concentrated. How aneurysm damages the brain: aneurysm, enlargement, rupture, vasospasm, and signal failure. That is the neuronal linkage. Unruptured aneurysm, often asymptomatic headache, blurred vision, ptosis, facial numbness. Ruptured aneurysm, thunderclap, headache, neck stiffness, vomiting, seizures, confusion, focal neurological deficit. Compression affects cranial nerves, uh, blood in the subarachnoid space, irritates meninges, and disrupt neuronal linkage. That is the classical warning sign, worst static of life after all. Diagnosis: non-contrast CT brain, CT angiography, digital subtraction angiography, lumbar puncture, and neurological examination. Emergency imaging is required after suspected rupture. Treatment: blood pressure control, stop smoking, serial CTA, MRA follow-up, treat vascular risk factors. Endovascular options: coiling, stenting, hollow diverting stent, useful selected neck location anatomy. Surgical, microsurgical clipping, hydrocephalus if there is hydrocephalus. Imodipine after SH and manage ICP. Intracranial pressure, seizures, vasospasm, and ICU complication. That is the treatment goal. Prognosis, good outcome. Complications, rebleeding, vasospasm, hydroscephalus, seizures, ischemic stroke. Poor outcome, severe SH, coma, delay treatment. Long-term care, rehabilitation, seizure control, community support. Prognosis is best when aneurysm is identified before the rupture. That is summary, online concept, mechanistic chain, and clinical priority. That is the schematic summary of the brain aneurysm. And that is the graphical summary. And you can learn from both the schematic summary and the brain summary of this lecture. Thanks and regards. Please like and subscribe this channel for further discussion on rare diseases. Thanks.